Hey everybody, Dr. Nichols here, and I wanted to start something new. I've been thinking about doing this for a long time, and I'm calling it A Day with Dr. Nichols. So I want to take a couple patient cases that I've seen over the week and, kind of discuss, my findings, what I see, treatment, to kind of give everybody an idea in regards to what I do and, potential, turnout for patients. So I'm going to talk about two cases that I thought were pretty cool. This first patient, so she is a 56-year-old female. She came in February of 2019 with achy joints, fatigue, stiff joints, can't lose weight. She has a history of anemia and, getting habitual cold sores. And, I took a thorough history, and she definitely has issues with hot flashes, night sweats. She had an ablation for heavy periods, but that didn't help, so she still got a period until she went through menopause. A lot of joint stiffness, worse in the evening, problems losing weight, fatigue after eating, a lot of dry eyes. She has fibrocystic breast disease. Her weight was around, 152. Her goal was around 125. She has had insomnia for 10 years, problems falling, staying asleep, night sweats, clenching, grinding at night, restless sleep. She would only get 4 to 6 hours of sleep per night, not rested in the morning, obviously. She's tried 10 milligrams of melatonin and didn't help her fall asleep or stay asleep. And she said she's a night owl. A lot of fatigue later afternoon, a lot of gas, bloating, sinus congestion, phlegm in the throat, kind of tending towards diarrhea. She would get an itchy nose after she eats food, and she feels that her, emotions would go to her gut. She'd get like a nervous stomach, sensitive stomach, and then would get diarrhea. In the past labs, in 2011, she had a hemoglobin A1C of 5.3, and as many of you know, I like to see that 5.0, so to me that was already a red flag. So ultimately what we did is we did some saliva testing for hormones, we did urine testing for neurotransmitters, and then we had blood work done. And so I saw her back in March, and we saw a lot. So she had, her A1C now is 5.6, so her average sugar was around 114, so that definitely went up since 2011. Her vitamin D looked good at 88. Zinc levels were a little low. We did a lipid panel, and her total cholesterol 213, triglycerides 108. I like to see that 80 or below. She had a lot of these small density LDLs, which looked at, which increases her cardiovascular risk by about 75%. And usually what drives the production of the small LDLs is blood sugar issues and insulin resistance. We did saliva testing. Cortisol levels were essentially low. Her catecholamines, norepi were low. Serotonin was low. Her dopamine was a little high, so definitely a conversion issue there. And that was about it in regards to some of the findings. So what we did was we put her on some vitamin D, did some stuff for conversion with vitamin C from neurotransmitter standpoint, gave her some 5-HTP to help increase serotonin levels, did some berberine for the insulin resistance and the small LDLs, some tyrosine to help with catecholamine production, some pregnenolone to help with cortisol production as well as progesterone production. We talked about her avoiding high histamine foods, and start some over-the-counter Zantac and some zinc. And that was in March of 2019. And so she followed up with me in May of 2019, And not only was she doing amazing, she essentially lost 22 pounds in 6 weeks. She was having no joint stiffness, no sinus congestion, no itchy nose after eating. She wasn't having any phlegm, gas, bloating. She was having a little bit of late afternoon fatigue still. Her sleep was more restful. She was not having any problems falling asleep. She was having problems staying asleep, but she could fall back asleep a lot faster. And she said, I had her add the Celtic or Himalayan salt to her water, and that did help with the leg cramps. And she was doing, and her eczema was pretty much gone at that point. So I just did a couple tweaks with increasing the 5-HTP. I increased the pregnenolone. This was in May, and then I said we'll do follow-up labs in 3 months, and we'll do fasting labs. And I just saw her today, and her weight was about 128 in May, and her weight today was 119. So she lost a total of over 30 pounds. And she's a little lady. So she did amazing. She said that she notices that when she eats carbs and gluten, it causes night sweats, and she might get, the itchy nose. Her sleep is still a little bit of an issue, staying asleep, but she falls asleep, faster again. She's getting the cramps again, but her energy's good. She's hardly having any late afternoon fatigue. She's not having any of the achy joints, no hot flashes during the day, no GI symptoms at all. And we did some repeat testing, and her A1C came down to 5.4, so it's going in the right direction. Her triglycerides came down to 53 now, which is amazing. And her number of small LDL particles came down to 431, which again is awesome. So she decreased her cardiovascular risk. It was like 75% to now 40%. Her insulin resistance scores are way better. And obviously she's happier. So we, maximize vitamin D, that looks good too. And so at the end of the day, we did, a couple things to lower cortisol at night regarding still, because she's having some sleep issues. And we kind of kept everything the same. I actually had her, she's going to try some sports salt caps to see if we can get rid of the leg cramps at night. And then I told her we'll keep everything else the same, follow-up testing in a year. So she did amazing. Her daughters, which are, in their early 30s, are asking Mom, what she's doing. Can I take the berberine, or can I do what you're doing? And so, ultimately, they're going to come and see me as well, because the apple does not fall far from the tree. So, Mom learned a lot about herself, which then can carry over to helping her daughters with some of their issues as well. So this is really cool, and it's really cool when patients get to see the results. I tell patients all the time, put those results on your refrigerator. You deserve it.